Jonathan Hull, good morning, Dr. B. Do folks on low carb sometimes develop low creatinine? What does that indicate? Does creatinine supplementation fix that? I haven't seen a lot of impact there, Jonathan. People assume that creatine is going to increase creatinine levels. There's some evidence, it's not very clear that it does, despite a little bit of evidence in that space. Creatinine is a protein type of chemical that's secreted by the muscles. Where we use creatinine, we use it all the time to look at kidney function. So we also use it in part of the inflammation testing. Cardiovascular inflammation tests is microalbumin creatinine ratio. Now, albumin is the most common protein in the blood. Creatinine is what we just mentioned. And the creatinine ratio helps us understand whether people are hydrated or dehydrated and the level of that amount. And then we look at how much protein they're spilling. Now, why does that tell us about cardiovascular inflammation? Here's how the kidneys work, very basically. Each kidney has about 1 million microfilters. And the filters basically are the arteries getting smaller and smaller until there's nothing left but a tiny filter space, and the muscle layer of the artery wall is not there. The only thing that's there is the intima. So the intima is actually the filter membrane of those million filters of the kidney. If you're spilling protein, albumin, through that intima layer into the urine, then there's a very high correlation to having cardiovascular inflammation and spilling LDL, the major component of plaque, through that intima layer into the artery wall. So that's the connection on creatinine and cardiovascular inflammation. But again, back to your point, Jonathan, I don't really see a whole lot of interaction between low carb, creatinine problems, and or even creatine in the diet.